Hello and welcome. Today we're diving into the intricate world of the nervous system to understand a condition known as arteriovenous malformation, or AVM. We'll explore what it is, why it happens, how it affects the body, and what can be done about it. Join us as we unravel the complexities of AVM. The precise cause of AVMs remains somewhat of a medical mystery. They're generally believed to be congenital, meaning individuals are born with them. AVMs aren't considered to be inherited, so they don't typically run in families. Instead, they're thought to arise from errors during fetal development, specifically during the formation of blood vessels in the brain or spinal cord. Why these errors occur in some individuals and not others is still a subject of ongoing research. To grasp the effects of an AVM, it's crucial to understand normal blood flow. Arteries carry oxygen, rich blood from the heart to the brain. This blood then travels through capillaries, tiny vessels that deliver oxygen and nutrients to brain tissue. Veins then carry the oxygen, depleted blood back to the heart. In an AVM, this normal process is disrupted. Arteries and veins are abnormally connected, bypassing the capillaries. This creates a tangled mass of vessels where high-pressure arterial blood flows directly into the veins, which aren't designed to handle such pressure. This can weaken the vessel walls, leading to potential rupture and hemorrhage. Furthermore, the surrounding brain tissue may not receive adequate oxygen due to the shunting of blood away from the normal capillary network, potentially leading to neurological deficits. AVMs are relatively rare, affecting less than 1% of the population. While they can occur in anyone, they are typically diagnosed between the ages of 20 and 40. Men and women are affected equally. It's important to note that many individuals may have AVMs that remain asymptomatic throughout their lives, meaning they never cause any problems or are never detected. The signs and symptoms of an AVM can vary widely depending on its size, location, and whether or not it has ruptured. Some individuals may experience no symptoms at all. However, common symptoms include headaches, which can range from mild to severe. Seizures are another frequent symptom. Other potential signs include muscle weakness or numbness, vision problems, difficulty with speech, and problems with coordination or balance. In severe cases, a ruptured AVM can lead to a hemorrhagic stroke, resulting in sudden and severe neurological deficits. Diagnosing an AVM typically involves a combination of neurological examination and imaging studies. A neurological exam assesses the patient's reflexes, muscle strength, coordination, sensation, and mental function. Imaging techniques such as CT scans, MRI scans, and cerebral angiograms are crucial for visualizing the AVM and determining its size, location, and the involvement of surrounding blood vessels. A cerebral angiogram, considered the gold standard, involves injecting a contrast dye into the blood vessels to provide detailed images of the AVM's structure. While there isn't a standardized classification system universally adopted for all AVMs, the Spetzler-Martin grading system is commonly used for brain AVMs. This system considers the size of the AVM, its location in relation to eloquent brain areas, areas controlling critical functions like speech and motor skills, and the pattern of venous drainage. The Spetzler-Martin grade ranges from 1 to 5, with higher grades indicating a greater risk of complications during treatment. Treatment for AVMs aims to eliminate the risk of hemorrhage and alleviate symptoms. Management options depend on the AVM size, location, and the patient's overall health. Treatment modalities include surgical resection, endovascular embolization, and stereotactic radiosurgery. Surgical resection involves surgically removing the AVM. Endovascular embolization involves threading a catheter through blood vessels to deliver materials that block off the AVM. Stereotactic radiosurgery uses focused radiation beams to gradually obliterate the AVM. Sometimes, a combination of these techniques is used. The decision on which treatment is most appropriate is made on a case-by-case basis by a multidisciplinary team of specialists. Unfortunately, there's currently no known way to prevent the formation of AVMs, as they are believed to be congenital. Because AVMs are thought to occur during fetal development, there are no specific measures a person can take to prevent themselves from forming an AVM. The focus remains on early detection and appropriate management to minimize the risk of complications. The prognosis for individuals with AVMs varies greatly. Some individuals may live their entire lives without experiencing any symptoms or complications. Others may face significant neurological deficits due to hemorrhage or the mass effect of the AVM. Recent research focuses on improving imaging techniques for earlier and more accurate diagnosis. Advancements in endovascular techniques and stereotactic radiosurgery offer less invasive treatment options. Researchers are also exploring potential genetic factors that may contribute to AVM formation, which could potentially lead to future preventative strategies.